Hello everyone, my name is Amanullah, and this past summer I had the opportunity to work alongside my faculty mentor, Dr. Eileen at the Center for Health Outcomes and Policy Research at the University of Pennsylvania School of Nursing. Today I'll be presenting my project, which focuses on hospital nurses' moral distress and mental health during COVID-19. Throughout the pandemic, nurses encountered unprecedented obstacles due to their roles as the frontline workers for the healthcare field. As a result of their expansive roles and the consequential implications on their health, this study was developed to better assess the factors which are related to nurses' moral distress and their longer-term mental health. Nurses lacked proper personal protective equipment and also experienced a lack of practice guidelines. Additionally, crisis standards of care were not prepared before the pandemic, resulting in poor distribution and use of already scarce resources. In order to better understand the context of this study, one must first grasp the concept of moral distress. Moral distress is knowing the right thing to do, but not being able to do it because of constraints which thereby threaten one's moral integrity. This can be demonstrated by feeling powerless and by an inability to voice one's opinion. Additionally, moral distress can be divided into three main categorical levels. These levels are patient, unit or team, and hospital or system. We hypothesize that the moral distress which nurses experienced throughout the pandemic likely contributed to poor mental health and that it may be mitigated through effective leadership communication. The main purposes of this study were to examine the frequency of caring for patients with COVID-19, to assess access to PPE and cleaning supplies, to scrutinize the quality of communication by hospital leadership regarding hospital policies for patient care delivery, and to study how nurses' moral distress related to their longer-term mental health. To gather data, a survey was sent out which contained 5 main sections. The sections were COVID-19 care frequency, PPE and cleaning supply availability, moral distress, nurses' mental health, and leadership and communication. The sample included registered nurses who provided direct patient care and was assessed using a cross-sectional correlational survey design through a platform called REDCap. Results from the survey demonstrated that nurses endured anxiety, feeling withdrawn, and had difficulty sleeping 2.5 days of the week. Additionally, a decrease in moral distress was found to be correlated with improved leadership communication and better access to PPE, which were also associated with longer-term mental health. We found a connection between moral distress and the volume of infected patients, access to PPE, and communication from leaders. Whilst looking at these results, it is also important to acknowledge limitations of the study. Due to response biases derived from personal experiences and variation in factors which we did not account for in our survey, our results may not be applicable to nurses working in different settings. Furthermore, there are variables such as nurses' pre-pandemic mental health, their resilience, and their work environment which participants were not surveyed on but had the potential to skew or influence the data. Ultimately, we have concluded that we need to create resilient structures to meet future challenges. This includes, but is not limited to, nurse managers providing clear guidelines to nurses, crisis standard of care policies being developed and implemented, and resources being readily available to nurses most affected by mentally draining situations such as caring for large populations of COVID-19 positive patients. This study should serve as a model to place a heavier emphasis on the importance of communication and transparency, as well as the dire need to improve nurse work environments. Finally, I would like to express my gratitude to everyone at Chopper for their continued support. Thank you to Dr. Lake for allowing me to participate in her research and for her mentorship. Additionally, additional thanks to Kathleen Rosenbaum for her guidance and dedication. Thank you to Kayla Fowler, Douglas Project Super, and the program's donors for making this opportunity possible, which has truly pushed me to grow both academically and personally. And lastly, a big thank you to everyone in attendance at the symposium for listening to my presentation. Thank you all.